Diabetes is a disease that occurs when your blood sugar, aka blood glucose, is too high. Glucose is a monosaccharide sugar and is your body's main source of energy. Your body normally cannot make glucose, and it normally comes from the food we eat. What is insulin? It is a hormone made by the pancreas that helps glucose get into your cells to be used for energy. When you have diabetes, your body does not make any insulin, or it makes very little insulin, or your body is not able to make use of the insulin you make properly. What will end up happening? Glucose will then stay in your blood and does not enter your cells. This is Health Series Episode 2. Subscribe, like, and share. Diabetes raises the risk for damage to the eyes, kidneys, nerves, and heart. Diabetes is also linked to some types of cancer. Taking steps to prevent or manage diabetes may lower your risk of developing diabetes health-related problems. What are the complications of diabetes? We have acute and chronic complications. Acute complications, number 1, diabetic ketoacidosis and diabetic coma. It's considered an emergency, especially with high levels of ketones. We have hypoglycemia. It can be a complication of diabetes treatment. We have hyperglycemia. Can be as a result of blood sugar being too high. Then we have chronic complications. Number 1, we have macroangiopathy. Secondary conditions that you can get from macroangiopathy include coronary artery disease, strokes, erectile dysfunction in men. You can get diabetic retinopathy, which is the most common cause of blindness, diabetic neuropathy, characterized by sensory disturbances, muscle atrophy, and walking difficulty. Diabetic foot, they're very common in our hospitals today. These are diabetic-related lesions that occur in diabetic patients. Vulnerability to infections, myopathy, osteoporosis, and liver damage. Other complications include coronary disease, congestive heart failure, and arterial hypertension. As you have seen, diabetes can be a mountain because of the many bad and serious complications you can get. Growing up, there was a lot of stigma associated with diabetes, at least in my experience. People really feared diabetes, and some of them thought it a death sentence. But with education, we come to learn that diabetes is actually a small thing. All you need to do is make sure it's managed and stabilized at the required levels. Only that. Symptoms of diabetes include frequent urination, especially in the evening, polyuria, polydipsia, polyphagia, and intense hunger, weight loss, weakness or feeling very tired, lack of interest and concentration, vomiting and stomach pain, blurred vision, commonly getting infections and inflammation and wounds that are slow to heal, tingling sensations at the extremities. Those like being feeling like you're being triggered. What are some of the investigations or tests that you can take to confirm that you have diabetes? Fasting plasma glucose test, normally done in the morning after fasting for 8 hours. We have HbA1c test. This one will provide you with your blood glucose level for the last 3 months. You're unlikely to get correct values if you have anemia or you're in your second or third trimester of pregnancy. You can take a random plasma glucose test. This test is instant and does not require fasting. Glucose challenge test. It's mainly taken where gestational diabetes is suspected. Then you have oral glucose tolerance test. Let's talk about management of diabetes. Management is based on types. We have type 1, type 2, gestational diabetes, and monogenic diabetes. If you have type 1 diabetes, your body makes little or no insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. If you have type 2 diabetes, the cells in your body don't use the insulin you make properly. Or your pancreas can be making insulin, but not enough to keep your glucose level in the normal range. Other types include gestational diabetes. This is a type of diabetes that develops during pregnancy. Most of the time, gestational diabetes goes away after the baby is born. If you've had gestational diabetes, you have a higher chance of developing type 2 diabetes later in life. With prediabetes, have blood glucose levels that are higher than normal, but not high enough to be diagnosed with type 2 diabetes. Other types, we have monogenic diabetes. It's normally caused by change in a single gene. It's diabetes secondary to things like surgical removal of the pancreas or pathological reasons such as diseases such as cystic fibrosis or pancreatitis that can give you monogenic diabetes. How do you manage high blood sugar? We have a combination of diet, lifestyle changes, and medication. We have the ABCs, it's an acronym. A stands for the A1C level, keep it below 7%. B stands for blood pressure, ensure your blood pressure remains below 130/80. C stands for cholesterol, ensure your cholesterol levels are low to avoid getting a stroke or a heart attack. S stands for smoking. Smoking is contraindicated when you have diabetes. Number 2, you should create a meal plan. Get yourself a diabetic-friendly meal plan. Number 3, physical activity. Working out, or any form of exercise is recommended. Avoid sedentary behavior. Get enough sleep. Take care of your mental health and avoid stress. What medication are you supposed to take when you have diabetes? With type 1 diabetes, there's insulin. It's available in form of injectables and insulin pumps. Then we have artificial pancreas. This is a delivery system that uses automated insulin. Type 2 diabetes, we have medications such as biguanides, e.g. metformin, help reduce glucose production in the liver and improve insulin sensitivity. We have sulfonylureas, example, glimepiride. They help stimulate insulin release from the pancreas. We have the zolidinediones, example is pioglitazone. They enhance insulin sensitivity in muscle and fat tissue. We have alpha glucosidase inhibitors, examples, we have acarbose. They delay carbohydrate digestion and absorption in the gut. We have peptidase inhibitors. They increase levels of incretin hormones. We have sodium glucose cotransporters and meglitinides. We also have injectables for type 2 diabetes. People with type 2 diabetes can also take insulin, GLP-1 antagonists, amylin analogs, and dual GLP and GIP receptor agonists. What are the risk factors of diabetes? Obesity, when you're overweight, being 35 years of age and older, family history of diabetes, being Black, Asian, or Hispanic, or Pacific Islander, if you are usually sedentary and not physically active, prediabetes, and if you've ever had gestational diabetes. To prevent diabetes, maintain a good weight, avoid smoking, exercise and be physically active, observe your diet and avoid high cholesterol diet, limit your alcohol consumption, and eat a balanced diet. You should also monitor your blood sugar levels regularly, manage stress effectively, and get regular checkups with your doctor. You may be able to delay or prevent diabetes health problems by leading a healthy lifestyle, taking your medicines, and managing your blood glucose level. I'm Sherry Kinyanjui. Thank you for watching.